Now, Ghana has launched an aggressive drive to scale up comprehensive public health approach towards the elimination of hepatitis B by the year 2030. It is a viral infection that attacks the liver and can cause both acute and chronic forms of diseases. Under the global theme, Hepatitis-Free Future, with a focus on prevention of hepatitis B among mothers and newborns, Ghana joins the rest of the world to call for more care and increased determination to increase resource allocation as well as investment in the health and well-being of pregnant women and their newborn babies. The WHO is leading this charge on World Hepatitis Day.
A hepatitis-free future is within our reach. WHO is calling on all countries to work together to eliminate viral hepatitis as a public health threat by 2030. Viral hepatitis is an inflammation of the liver that can cause a range of health problems, including severe liver disease and liver cancer. There are 5 main strains of the hepatitis virus. Together, hepatitis B and C cause an estimated 1.3 million deaths each year. In the midst of the COVID-19 pandemic, viral hepatitis continues to claim thousands of lives every day. Hepatitis B is most commonly transmitted from mother to child during delivery and in early childhood. Hepatitis C is most commonly transmitted by exposure to blood through unsafe healthcare procedures and injection drug use. WHO's Global Hepatitis Strategy outlines ambitious targets to achieve elimination of viral hepatitis by 2030. These include reducing new hepatitis infections by 90% and reducing deaths by 65% compared to 2015 levels. Although progress has been made globally, access to prevention, diagnosis, treatment and care services for hepatitis B and C remain too low in most countries. An estimated 80% of people living with hepatitis are unable to access the services they need. A hepatitis-free future is achievable, but only through a global and united effort. All newborns should be vaccinated against hepatitis B at birth, followed by at least 2 additional doses. All pregnant women should be routinely tested for hepatitis B, HIV and syphilis, and receive treatment if needed. Everyone should have access to hepatitis prevention, testing and treatment services, including people who inject drugs, people in prisons, migrants, and other highly affected populations. Timely testing and treatment of viral hepatitis can prevent liver cancer and other severe liver disease. Prevention and care services for hepatitis, such as infant immunization, harm reduction services, and continuous treatment of chronic hepatitis B are essential even during the pandemic. Now is the time to scale up access to prevention, testing, and treatment services for viral hepatitis for all in need to achieve a hepatitis-free future.
A major concern, though, is the inability of sufferers to test or access treatment due to the high cost involved. We'll be having a conversation with officials of the World Health Organization and the representative of the mPharma, the Ghanaian healthcare technology startup, which is helping ease the burden for some women at risk, especially in rural areas where many women lack access to routine testing during pregnancy. Right now, here are the numbers. Well, as you know, Ghana is classified as highly endemic, and up to 4.6 million sufferers. We have existing 4.6 million sufferers at the moment. Up to 147,000 newborn babies will be exposed during delivery, and up to 90% will be infected. Joining me is Dr. Kafui Senya. Is a public health specialist with the WHO and responsible for HIV, tuberculosis and hepatitis B. Also joining us is Dr. Ya Ampong, who is a health service manager of mPharma, the Ghanaian healthcare technology startup, which is helping to ease the burden for some women at risk. You're welcome.
Thank you.
Hi.
Thank you.
All right, I wanted to be sure that you could hear me. So Ghana is essentially classified as highly endemic because of the high number of people, or the number of people that have been infected. This is correct, right? Yes, it's you. It's to you, sir.
Okay. Thank you and good afternoon to all your listeners. Yes, you are right. Ghana is classified as highly endemic with hepatitis because of the huge number of people that are infected. The WHO classification says that any country that has a prevalence higher than 8% is classified as highly endemic, and Ghana's prevalence is estimated between 11 to 14%. So that's why Ghana is classified as highly endemic.
Okay, 11 to 14%. Let me come to you, when we hear figures like this, we're tempted to believe that, sometimes you're tempted to gloss over it because for you, it doesn't really represent the human beings. But you are working on the ground, especially in rural areas, and trying to help women, especially, or people who are highly at risk. What do you see on the ground in terms of, backing up the point that Ghana is classified as highly endemic?
Thank you very much, and good afternoon to your viewers. So first of all, what I would say is on the ground, we are seeing that there's inadequate knowledge about hepatitis in general. And that was what would drive our numbers up, because a huge part of the population has no clue what we are talking about when we mention hepatitis. Now, people like that in 10, 15 years' time, when they do find out, it's more complicated. And such people are in large numbers, and that is what is going to drive our numbers even higher, just like what Dr. Senya had mentioned.
So, Doctor, let me come back to you about the hepatitis itself. I mean, I'm not necessarily very much aware of symptoms, for example. How do I know when someone has it? How do I know to check? What sort of symptoms should I be seeing? Is it asymptomatic? I mean, what can you tell us about hepatitis by way of education?
Okay, so hepatitis is viral, and yes, mostly it's asymptomatic, or very similar to most HIV. It's a close relative of HIV. So for many years, you would have it and you would not have any symptoms. It multiplies in your system and keeps growing till it gets to the point it's mainly in the liver. That's why it's called hepatitis. That's a Greek. Hepa is a Greek for liver. So it's basically a virus that keeps just growing and affecting the liver. By the time you start having symptoms, it often is way too late. And the symptoms are related to yellow eyes, or what's medically called jaundice. You have fever and all of malaise and weakness, and it eventually just becomes a cancer with weight loss and eventually leads to death. So when we talk about hepatitis, we are not really looking at waiting for symptoms to present before you visit a health facility. The recommendation would be that you take the tests and make sure that that's the screening test. If you are negative, you can get vaccinated to prevent you from getting the infection. If you are positive, then you seek early intervention and treatment to prevent it from growing and becoming the cancer. The important addition I want to make here is that the World Health Organization is recommending that we focus a lot more of this testing on pregnant women to reduce transmission of the infection to newborns who are more at risk when it comes to the disease progressing to become a cancer.
Okay, so I guess that will be one of the biggest challenges for us here in Ghana, the mother-to-child transmission. Is it, Dr. Senya?
Yes, you are right. That's and it's not only in Ghana. It's hepatitis generally is more severe in the sub-Saharan Africa and the Western Pacific region of the world, which have the highest prevalences. I'm speaking more specifically about hepatitis B.
Okay.
Which is the major issue that we are throwing or emphasizing, is the more common form. C is also there, but the B is what is more common.
Yeah.
So yes, it's the mother-to-child transmission is a very major factor because, like I explained, the virus can stay in a person for very long before it eventually develops into the cancer, which eventually leads to death. So you can imagine if an adult in the 30s or late 20s gets exposed and gets infected, the person has a shorter time and the cancer is because the person is an adult, the immune system is also more developed. So the progression of the disease is not as rapid as a newborn baby with very low immune system. That baby, the virus replicates very fast in the child. And by the time the child is in the midlife, the 20s and the 30s, where productivity is high, that's the time that the cancer then develops, and then there's premature death. So that's why it's important that, especially in settings like ours, the limited resources that we have, we push it as much as possible to ensure that no newborn child gets infected with hepatitis, because when they get infected, the infection is more likely to end up developing into a cancer at the prime of their life and end up killing them.
Unfortunately, though, we're having an issue of cost when it comes to the testing, etc. And we have pregnant women. I mean, you can talk about pregnant women who have the resources, but I can tell you for a fact, even though I have not done any research, that there are a lot more pregnant women who cannot afford this treatment. But let me bring in Dr. Ampong. Here's where you come in. Your organization has been helping women who cannot afford the cost of testing and treatment. What exactly is being done there? How do you think we can improve this?
So we are targeting the general population, actually.
Okay.
For today, World Hepatitis Day, we are offering free hepatitis B screening for every person. All you have to do is call us. We take your details just so that maintain, reducing crowding at the facility, because we need to find the missed people who are hepatitis B positive and are unaware. As I said earlier, these are the people that are driving our figures upwards. So this is what we are doing today, and then for the rest of the
okay, I'd like to take the number and share it with people who, I mean, we'll just share it with the rest of the world here on the TV, and hopefully people who turn up, you'll be able to screen them. Do you want to share with us details?
Yes, sure. So you can call us on 0244.
Mm-hmm. Yes. 0244
8038.
Okay, please go through that for me again.
358038.
358038.
Yes, you can. Yes.
Okay, yeah, I know the Zoom thing, and I know how it's working. Don't worry, we'll get around it. So that number is 0244 358038. And this, everybody can call you and perhaps perhaps book a testing, right?
Yes.
Okay. I'm bringing you back in, Dr. Senya. Now, we can't be having this in a pandemic, can't we? Unfortunately, we are. Is there any relationship between hepatitis and coronavirus? Do they make someone who is exposed to coronavirus more prone to, death? What's the relationship?
So the relationship is that they are both viruses, but like COVID is fairly new and we are learning a lot about it.
Yes.
We know that people who have comorbidities are more at a higher risk of being hit harder by COVID. So those generally will be the linkage between them. The fact, however, is that before COVID and during COVID and after COVID, hepatitis and other disease conditions are still creating a lot of havoc So whilst we put so much attention on COVID, and it's rightly so, we also should not lose focus of all these other disease conditions that are also taking millions of lives each and every week.
Dr. Ampon says that they're focusing on everybody, even though I think that they've also primarily been interested in pregnant women because of the mother-to-child transmission. What, from your perspective, with being with the WHO, will help, in dealing with this holistically as we wrap up this conversation?
Yes, so holistically, we need all stakeholders and advocates to come on board and support, just like M-Pharma is doing. We need the corporate and private sector to be very engaged and involved in the response. The government, as we know, is doing its best, is putting in a lot of resources, but the fact remains that we are a middle-income country with very limited resources. The national purse is limited in what it can do. But this hepatitis is one area that the private sector and corporate entities can put in support and see results that are tangible and will go a long way to help. So I would encourage that kind of support, linking through the National Hepatitis Control Program of the Ghana Health Service, or through the WHO. We can link you up, or through the Ministry of Health, to provide support. There's a lot of needed support, especially to ensure that by the country is aiming to improve the testing of pregnant women. Like I mentioned, that's the focus, and the WHO is providing all the technical support to make sure that that happens.
All right. I'm going to end with final words from both of you on what you want people to take away from this conversation as far as being alert on hepatitis is concerned. Let me start with you, Dr. Ampon.
So final words for me would be that everybody should know that hepatitis is actually, with regards to hepatitis B, is actually preventable. Like Dr. Senya has said, you need to get screened. When you test negative, you need to get the vaccine. You need to protect yourself, especially with Ghana's strategy in preventing the mother-to-child transmission. It's important that young women make sure that they screen themselves and get the vaccine even before they get pregnant. So that's the final word for me.
I like that, the fact that the way you added the pregnant bit for us, also for all pregnant women. You certainly want to be careful because you can transmit this to your child. Dr. Sanya, your final word. What do you want people to take away from this conversation today that we're celebrating or commemorating World Hepatitis Day?
So first, to the general public and viewers, that like has been emphasized, hepatitis is preventable, and preventing it is the best way to go, especially for newborns. We all need to work together. If you are pregnant, make sure that you get tested for hepatitis. If you are positive, there's a vaccine that can be given to the baby at birth to make sure that the baby does not get hepatitis at all. So please, every pregnant woman should make sure that they get tested, and if they are positive, they'll be given the vaccine and they themselves will receive treatment, and the general public as well. And then I've already mentioned to corporate Ghana to come on board and support the fight against hepatitis. Thank you.
Thank you so much. I remind you all of the global theme once again: hepatitis-free future, with a focus on prevention of hepatitis B among mothers and newborns. I've been doing this conversation with Dr. Kafui Senya, who's a public health specialist with WHO, and he's responsible for HIV, tuberculosis, and hepatitis. Also joining us was Dr. Ya Ampon, Health Service Manager for M-Pharma. That's a Ghanaian healthcare technology startup which is helping to ease the burden on women at risk. She says you can call 0244-358038 so that they can test you for free. It's 0244-358038. Call them, they'll test you, give you a hepatitis test for free. Ladies and gentlemen, thank you so much for your time this afternoon. God bless you.